the immunological piece of this, I think that's a huge, huge barrier in care. And so we really want to make sure before we just step into IUI or IVF, we're actually digging deeper into that, because those factors can still play a negative role. If you have that infectious piece, yes, okay, let's say you do an IUI, you do a sperm wash, it washes away the bad sperm. We are going to be left with better sperm. Is the quality impacted? Potentially, maybe, don't know for sure. But we're likely getting a better selection of sperm put closer to the fallopian tube in an IUI to do its job. Awesome. But the other side to that coin is if you do have the male portion of this factor has some sort of chronic infection, you're likely passing that on to your partner. And now we're opening up a whole nother can of worms in terms of where do we go from here with treatment. And we should not be investing in IUI or IVF if there's the potential for that chronic infection and endometritis and dysregulated uterine microbiome, because we're literally wasting money and hope and time. We don't want that, right? We want like the literal exact opposite of that. So that's why sperm agglutination is important. Truthfully, it's not something we see all that often. So it's not like, 50% of semen analysis we look at, which is, lots throughout the month. We're seeing this over and over and over again. It's not a very common piece, but if it's there and it's being ignored or brushed aside, I want you to really, really advocate to dig deeper, because especially if you guys have been told you have unexplained infertility, or if you've been told that everything looks good, this could potentially be that box that you've been looking for, that like golden ticket you've been looking for in terms of really, really understanding not just what's wrong, but how to actually treat it to get pregnant, versus just trying a bunch of things and hoping for the best, which is not why you guys are listening to me on this podcast, right? Because that's not what we do here. We want to find that root cause piece, and then we want to give you well-researched, backed solutions that are truly going to optimize your fertility and not just guess.